Canada has also secured millions of other vaccines should they receive Health Canada's approval. So how far off is the green light for a third vaccine candidate? But first, what should Canadians know about this newly approved Moderna vaccine? Dr. Supriya Sharma is the Chief Medical Advisor at Health Canada. She joins us from Ottawa. Doctor, thanks so much for joining us.
Thanks for having me.
So this vaccine from Moderna, easier to store, easier to transport, seems like a significant step in Canada's vaccination efforts.
No, absolutely. I mean, we're privileged to have two vaccines that have very good effectiveness, but you're right. So the Moderna is also frozen, but it can be stored at sort of more normal frozen temperatures, around minus 20 degrees. And then once thawed, it can be stored in a fridge for up to 30 days. So that makes it much easier to transport and to store.
So this makes it easier to get to remote and rural and northern parts of the country. But there's a lot of ground to cover and a lot of people to jab, right? So when you look at the target, it's to vaccinate most Canadians by September 2021. When you look at the doses that are coming in and the pace they're coming in, how realistic is that September timeline?
You know, I think it's still realistic. I think, we've got the two vaccines that we have authorized. We are seeing shipments coming in. Those are expected to ramp up through the first quarter of 2021. We have two others that are under review right now. And so, we'll have to see how those go. But certainly, even with the two vaccines that we have now, we're expected to see significant shipments and, again, ramping up as we go through 2021.
So there's the manufacturing and the delivery of the doses, but then there's also the management of the doses once they get here, because it's 2 jabs per vaccine. So some provinces, they held back on the initial doses of the Pfizer vaccine to make sure people could get their second dose. Would you recommend they do the same thing with the Moderna vaccine?
So it's really, both approaches are reasonable. So some provinces are saying, we want to make sure that we have that second dose right on day, whether it's 21 or 28, depending on the vaccine. So we don't want to risk not being able to do that. Others have said, well, we have enough reliability in terms of the shipment, so we're going to go ahead and vaccinate as many people as we can with that first dose. And then potentially, if we're a little bit late on that second dose, we think it's going to be okay. So both are okay. I think what we're finding is that now we've got a bit more reliability in terms of the next doses and the next shipments that are coming. So I'm expecting to see more provinces and territories think about, potentially giving more of those doses up front. And I just wanted to also say that our National Advisory Committee on Immunization, NACI, is taking a look at some recommendations around first dose, reserving second dose from an ethical perspective and weighing those pros and cons as well. And we're expected to see that information and advice come out fairly soon as well.
One of the things that jumped out for me today when you were announcing the approval is that a single dose of Moderna gets you up to 80% protection. Could you adopt a strategy where you just give people a first dose and then vaccinate as many people as you can at 80%, or does that 80% go away and degrade if you don't get the second dose in a set amount of time?
Yeah, no, that's a really good question. And we know that when you get a vaccine, it's not like an on and off switch that immunity just, you're at 0 and then you're at 95%. We know that it builds over time. And certainly with the Moderna vaccine, when they checked for immunity, it was fairly close to that second dose. And there's more of time between the first dose and second dose, so 28 days versus 21 days. So it's not surprising that it would be a higher level of immunity. What we know about the mRNA vaccines, though, is that all the studies involve 2 doses. So for that vaccine to have the expected effectiveness, so either 94 or 95%, and for that to persist for a longer period of time, you really do need your second dose. So we're not talking about single dose for these vaccines, although we do have the Johnson & Johnson vaccine under review, and they do have a consideration for just a single dose.
Okay, so the good news is the approval of this vaccine and the imminent arrival of the doses. Sort of the concerning news out there right now with this story is this variant strain that has appeared in the United Kingdom. How worried should people in Canada be about this mutation in the COVID virus?
So first, it's to know that that's what viruses do. They mutate. There are variants. In Canada alone for the COVID, the virus that causes COVID-19, we've seen hundreds of mutations. The vast majority of those don't really affect the way that the virus functions. So we're going to see more variations. With respect to the vaccines that we have, we've got both Pfizer and Moderna that have tested those vaccines on a whole range of variations, including ones in what we call the spike protein, which is what the vaccines build immunity to. And for those, it's shown that the vaccines are effective. So we're not concerned at this point in time about the effectiveness. We think that the vaccines will be effective against this strain as well. But we've also asked the companies to test their vaccines specifically to that strain.
Okay, and have you been talking to your colleagues in the United Kingdom? Are they giving you any information that helps guide Canada through this particular process?
Absolutely. So we work really closely both on the regulatory side with respect to vaccines. Our lab folks in the National Microbiology Laboratory are very well networked with those in the UK and other countries. We've got a South African variant as well, and we've also seen the variant in other countries. So internationally, we're very well networked to get more information as it becomes available. And from the clinical information to the laboratory information, we're very, very well networked.
I know you've only just approved the Moderna vaccine today, but I have to ask you about what's next, right? Because there are other vaccines you're looking at. We've got the Oxford AstraZeneca one, the Johnson & Johnson one, or the Janssen one that you mentioned is the single-dose vaccine. Where do those stand right now? I know they're under review, but are we looking at like first quarter potentially for approval of them? Like, can you give us a ballpark on timeline?
So for both those reviews, they are under review. It's a rolling review. So we've got some information for both those reviews, but we don't have a complete package. And that's why it's really challenging right now to be able to say when that review might be complete. So for AstraZeneca, there's some study information that we already have. So we know that we're looking, we have reviewers that are looking at that. There's significant manufacturing information that's still yet to come in. So we don't know exactly when we'll get that. For the Johnson & Johnson vaccine, again, review is moving very well, but their major clinical trials will only start to read out or have some results at the end of January, beginning of February. So it really depends on when we get that data and how that review goes that will determine when we might make a final decision. So it's a bit early to predict, unfortunately, exactly when those will be completed.
But we're most likely talking months, not weeks, when it comes to these next vaccines.
Yeah, I think that's safe to say.
Okay. All right, Dr. Sharma, thank you so much for your time.
Thank you. Happy holidays.
You too.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.